Observers without goggles must face away from the blast. 3, 2, 1, 0.
For decades, the Navajo Nation has been dealing with the deadly consequences of radioactive pollution from uranium mining and milling.
Have you or a loved one suffered from an illness following the testing of nuclear weapons or the production of uranium for our nation's defense?
Our screening program here at the Specialty Care Center is set up to screen patients for common cancers like breast cancer and colon cancer. Cancers that, if detected early, can be cured. And our radiation exposure screening and education program is set up to encourage our patients to come in early and get screened for these common cancers. Our patients have real concerns about potential uranium and radiation exposure in the past.
A lot of our people now do have cancer of one form or another. Not only do we have the Navajo Nation, the Hopi Nation, you also have the Paiute Nation down in Bitter Springs. And so when it came to me to apply, once I knew the process, it was pretty quick and easy. But it was the help of the office there that helped me get to this point.
The Specialty Care Center is offering radiation exposure screening clinic for all 18 years and older. The Radiation Exposure Compensation Act expires July of 2022. Have you or a loved one lived in the downwind regions from January 21st, 1951 through October 31st, 1958, or during the entire month of July 1962? Have you or a loved one been diagnosed with one of the following cancers or illnesses? If you meet all the qualifying requirements to file for a RECA claim, please file soon because the Radiation Exposure Compensation Act ends in July of 2022.
I didn't have too much problem with filing because I didn't know what to expect. I just said, okay, I'll apply. See what happens. And that was kind of what I did. And both my wife and I talked. And when we talked, well, she said, well, let's just go ahead and file, see what happens. And so that's why we did that. That's why we filed, just to see what was going to happen, since we didn't know much about it. But once the process came and started, it was pretty quick and fast. I was really amazed at how quickly things were done.
The Radiation Exposure Compensation Act is ending in July of 2022. Congress passed RECA to compensate qualifying claimants who are diagnosed with one of the listed compensatable diseases after working in a uranium mine or living in a designated downwind region for a specific period. Claimants could be compensated $50,000 or $100,000. To qualify for RECA compensation, for eligible individuals or past loved ones, we will need the following: a completed RECA claim application, proof of identification such as certificate of Indian blood, hospital birth records, school records, marriage certificate, death certificates for past loved ones, documentation of medical diagnosis of one of the qualified cancers or illnesses, proof of physical presence, such as medical records, federal records, religious organization, employment records, or educational records. If filing as a former uranium mine worker, additional employment history will be required.
Our first filing we sent about a week later, got a letter from the program and said it's gone to the paralegal. That was about a week later. And then I think it was, 2 weeks maybe later, and then comes back and says, yeah, you're qualified. And I was astonished at how quickly they processed it.
Fortunately, we have the Radiation Exposure Compensation Act, which gives patients the opportunity to apply for compensation from the Department of Justice to help with the financial costs of their treatment and their care.
There's nothing more important than early detection for cancers. That's when they are curable, and that's when the treatment would be a short period of time and would have the highest chances of curing. So what I would hope that all people would think about doing is seeing their primary care doctor, their nurse practitioner, and making sure that they're getting all the cancer screenings that are right for them. What I would also like to say is that even though the Radiation Exposure Compensation Act is sundowning July 2022, it may be possible that policy will be changed and it may be extended, and it may also be possible that they may change the age limit on people who were living here on the reservation as far as the exposures that they may have gotten to be able to be compensated for some of these horrible cancers.
Although this program is ending in 2022, our specialty care center will still be here. We will still be seeing patients with cancer.
To our people that's out there who are listening to this filming, I just want to say that the Radiation Exposure Compensation Act is going to end on July 2022. And I'm going to encourage every one of you to come and look at how you can apply for it, because I think this is something that will help you and your family to face the challenges that you have. And I can tell you, both the Hopi, Navajo, Paiute people, that I was privileged to have a chance to participate in this, and the people that are working with us really supported what took place with me, and I really appreciate that.
We are located in Tuba City, Arizona, on the Tuba City Regional Healthcare Corporation's main campus at 3008 East Cedar Avenue. For more information, please call the Radiation Exposure Screening and Education Program at 928-283-1802 or visit the webpage. This message is funded and brought to you by the Health Resource and Service Administration.